Welcome to the Health First channel. In today's video, we will discuss a very important and serious topic, pancreatic cancer and the 5 factors that can lead to its development. Before we begin, don't forget to like, comment, subscribe to the channel, and share this video with friends and family so that more people can become informed about this critical issue. Let's spread information and promote health together. Pancreatic cancer is widely known as one of the most dangerous types of cancer, with a high mortality rate. Annually, over 450,000 people worldwide lose their lives to this silent and deadly disease. Besides being among the 12 most common cancers, it has shown a 1% increase per year since the 1990s, making it increasingly prevalent. One of the biggest challenges of pancreatic cancer is that when it is diagnosed, only 5% of patients manage to live for more than 5 years. The reason is that this cancer is often discovered at advanced stages, as its early symptoms are usually vague and barely noticeable. The pancreas plays vital roles in the body, such as producing digestive enzymes and regulating blood sugar levels through insulin. When pancreatic cells mutate, they can grow uncontrollably, forming tumors that quickly spread to other parts of the body. Ductal adenocarcinoma is the most common type of pancreatic cancer, originating in the ducts that carry digestive enzymes to the intestine. Now, let's begin exploring the 5 main factors that can increase the risk of developing pancreatic cancer. These factors range from lifestyle habits to genetic issues, but the good news is that some can be modified, allowing for a reduced risk of developing this serious disease. 1. Tobacco use, a controllable risk factor. The first risk factor we will address is smoking. Smoking cigarettes and consuming other forms of tobacco is one of the main causes of pancreatic cancer. Studies show that up to 25% of pancreatic cancer cases are associated with tobacco use. This is because the chemicals in cigarettes, such as tar and nicotine, damage the body's cells, including those in the pancreas. Additionally, many of these compounds are classified as carcinogens, promoting mutation and uncontrolled growth of pancreatic cells. Although quitting smoking can be challenging, it is one of the most effective measures to reduce the risk of developing pancreatic cancer and many other serious diseases. For those looking to quit, various approaches are available, such as nicotine replacement therapies, psychological support, and even support groups. The decision to quit smoking can not only save your life, but also significantly improve your quality of life. Now that we have addressed the impact of smoking, let's move on to part 2, where we will discuss more factors that can lead to the development of pancreatic cancer and how to prevent them. If you enjoyed this first part, leave your comment and share your experiences with us. Part 2, modifiable risk factors and how to reduce pancreatic cancer risk. Now that we have discussed the role of smoking in the development of pancreatic cancer, let's continue exploring other risk factors that can also be modified to help prevent this disease. 2. Excess weight, the impact of obesity. Being overweight or obese is the second risk factor for pancreatic cancer. The accumulation of fat, especially in the abdominal region, directly affects the pancreas, increasing inflammation and overloading pancreatic cells, which have to work harder to regulate blood glucose levels. This constant strain can cause cell damage and mutations, increasing the likelihood of cancer development. Maintaining a healthy weight is essential to reducing the risk of many diseases, including pancreatic cancer. This can be achieved through a balanced diet and regular physical activity. Focusing on a diet rich in vegetables, fruits, lean proteins, and healthy fats can help keep weight under control. Additionally, it's important to avoid excessive consumption of processed foods, which are high in sugar and fat. 3. Diabetes, an important risk factor. Diabetes is another significant risk factor for pancreatic cancer, especially type 2 diabetes. In this condition, the pancreas constantly works to balance blood glucose levels, which can cause inflammation and damage to pancreatic cells. People with diabetes have a higher risk of developing this type of cancer, making proper glucose control a priority. Fortunately, diabetes is a condition that can be managed. Measures such as maintaining a balanced diet, exercising regularly, monitoring blood glucose levels, and, in some cases, using medication can help manage the condition and consequently, reduce the risk of pancreatic cancer. For those at risk of developing diabetes, making healthy food choices and adopting a more active lifestyle are effective prevention strategies. 4. Chronic pancreatitis, a warning for the pancreas. Chronic pancreatitis, a prolonged inflammation of the pancreas, is also a risk factor for pancreatic cancer. This condition can be caused by factors such as excessive alcohol consumption, smoking, and genetic factors. Continuous inflammation of the pancreas creates an environment conducive to cellular mutations, increasing the risk of malignant tumors. To reduce the risk of pancreatitis and, consequently, the risk of pancreatic cancer, it is important to avoid excessive alcohol and tobacco consumption. Maintaining a healthy diet and following medical advice to control inflammation are also key measures. If you suffer from chronic pancreatitis, it is crucial to have regular medical checkups to identify possible complications as early as possible. 5. Exposure to chemicals, a hidden danger. Exposure to chemicals, especially in the workplace, can increase the risk of pancreatic cancer. Professionals working in chemical factories, cleaning industries, or other areas involving toxic chemicals may be at higher risk. To minimize this risk, it is essential to follow safety measures in the workplace, such as wearing protective masks and gloves, and to consider changing roles if the exposure is prolonged. If you work in an environment with chemicals, have regular checkups to monitor your health and identify potential risks early on. These are the 5 main modifiable risk factors for pancreatic cancer. By taking preventive measures, you can significantly reduce the risk of developing this disease. In Part 3, we will explore the warning signs of pancreatic cancer and how to detect it early. Part 3, Pancreatic Cancer Warning Signs and Early Detection. Now that we have covered the modifiable risk factors and how to reduce them, it is crucial to be aware of the warning signs of pancreatic cancer. Although this disease is known for its late detection, recognizing symptoms as early as possible can increase the chances of early diagnosis and effective treatment. Let's explore the most common signs. 1. Jaundice, yellowing of the skin and eyes. One of the most visible signs of pancreatic cancer is jaundice, characterized by yellowing of the skin and the whites of the eyes. This occurs when a tumor in the pancreas blocks the bile duct, preventing bile from flowing to the intestines. Instead, bile accumulates in the blood, causing jaundice. If you notice sudden yellowing of the skin or eyes, it is important to consult a doctor immediately. Other symptoms that may accompany jaundice include itching, dark urine, and pale or oily stools. While jaundice can have other causes, such as liver problems, it should not be ignored, especially if it is accompanied by other signs. 2. Abdominal or back pain, a common but relevant sign. Abdominal pain is a common symptom of pancreatic cancer, especially when the tumor is located in the body or tail of the pancreas. The pain usually begins in the upper abdomen and may spread to the back. This pain is often described as persistent and may worsen after meals or when the person is lying down. If you experience persistent abdominal pain lasting more than 1 or 2 weeks, it is essential to seek medical evaluation. Although abdominal pain can be caused by various conditions, it should not be dismissed, especially if accompanied by other warning signs. 3. Unexplained weight loss and loss of appetite. Sudden and unexplained weight loss is another warning sign of pancreatic cancer. This can be caused by a combination of factors, including the impact of the tumor on digestion and metabolism. Additionally, pancreatic cancer can lead to a loss of appetite, as it interferes with the body's ability to absorb nutrients from food. If you notice rapid and unexpected weight loss without making changes to your diet or exercise routine, it is important to consult a doctor. Prolonged loss of appetite, especially if accompanied by other symptoms like abdominal pain or jaundice, should be investigated urgently. 4. Changes in stool, an important digestive sign. Pancreatic cancer can affect the production of digestive enzymes, leading to changes in stool. You may notice stools that are paler, oily, or harder to pass, as fat digestion becomes more difficult without adequate pancreatic enzymes. This can indicate that the tumor is interfering with the digestive process. If you notice persistent changes in stool, it is important to speak with a doctor. Digestive problems can have various causes, but when combined with other warning signs, they may indicate something more serious, such as pancreatic cancer. 5. Sudden onset diabetes, a possible sign of pancreatic issues. While type 2 diabetes is common, the sudden development of diabetes in a previously healthy person may be a sign of pancreatic cancer. This occurs because the pancreas is responsible for producing insulin, and a tumor can interfere with this process, leading to increased blood glucose levels. If you have been diagnosed with diabetes suddenly and do not have a family history of the disease, it is recommended to undergo further tests to rule out possible pancreatic issues. The combination of recent onset diabetes with other signs, such as weight loss and abdominal pain, should be carefully investigated. Now that you are aware of the warning signs of pancreatic cancer, remember that early detection can make a difference in treating this aggressive disease. If you notice any of these symptoms, do not hesitate to seek medical help and undergo detailed examinations. Incorporating healthy habits and having regular checkups are the best strategies to prevent and detect pancreatic cancer in its early stages. If you found this content useful, like, share with friends and family, and subscribe to the Health First channel for more videos on health and disease prevention. Thank you for watching, and see you in the next video.